Hi YouTube. I decided that since I have some time right now, I'll make my birth plan video. I realized that in this video I look huge. So weird, but hopefully this turns out okay. Basically I do not have a written birth plan. I just know what I want. And with my midwife, because I've had I've had this midwife for all of my babies so far, so for birth, like, the way I want my birth, she already knows. She has, she remembers whatever happened and stuff, since my kids have been close together, so she kind of knows. Yeah, and she does have my birth plan from my first child, so then she can just go off that too. But, for pain medication, I do not want pain medication. At this point, I'm open to pain medication, but I rather her discourage me from getting pain medication, which she does. Said that really weird. Which is very nice, because most hospitals and doctors try to push pain medication on you. My midwife doesn't. She tries to discourage me from getting it. Like, if I would get the epidural, then she would have to transfer me as a patient to the hospital or something like that, so then she wouldn't be the one that's delivering the baby or something like that. So that's something that I don't want to happen, and I do not want to have an epidural. With my son, I actually at one point was asking for one, but she was able to I guess push it off, so I just and again discouraged me from getting it. So I didn't get it, and I had a natural birth with my son, with no medication. She also, I don't know if she does this with all her patients, but right when the baby comes out, she actually places the baby on your chest for actually doing instant skin to skin. So then, yeah, which is really nice. And they also do delayed cord clamping, so they basically, baby comes out, if the cord's wrapped around the neck at all, they will unwrap it. That's what happened with my second. And then they'll place the baby on you right away. They'll wait a while to do the cutting of the cord till the cord stops pulsating and stuff. And then, I don't remember most of my births, because with all the pain and what goes on after I actually have my baby, I don't pay much attention. I kind of just look at the baby and, enjoy the moment. So then they get my husband to cut the cord no, not every time. I think with my son, my mom did, yes. But the first two, my husband did. But with my son, I think it was not with my son, with my daughter, my second daughter. My husband had bad cheeseburgers from McDonald's, and he just felt so sick. So he couldn't, no, that's why he didn't do, yeah, that was my son. So he couldn't do it, so that's why my mom did it. I've had too many babies. I can't even remember which is which, but, yeah, and basically, I know I'm having a girl, so there's no even ifs, ands, like, I don't have to think about circumcision. Also, I already know what I would do if it was a boy. We wouldn't circumcise, just like we didn't with my son. And yeah, so that's not a problem, because that's also something that she actually gave me a paper to fill out with my first that actually has a whole bunch of questions and what would you like to happen if this happens, or all of that. And honestly, I haven't discussed what would happen if I would have a C-section with her. But if that would come up, honestly, I would ask to be put under. Yes, people say C-sections aren't that bad, but I get almost anxiety attacks just thinking of if I would have to have a C-section, and I have way too much anxiety about it. I wouldn't be able to do it. It would just, it freaked me out way too bad. And I know that in that case, I wouldn't be able to see my baby for a while. But my husband would be and everything. So yeah, I would have to see about that. But so far my chances looking good for having another natural birth, so that's good. Basically throughout my labors, all I did was, with my first, I did try different positions. I think only one position actually. When I first got to the hospital, I just strictly was on a exercise, I cannot speak today apparently. I was on an exercise ball, and I was just kind of like bouncing slightly and getting through the contractions, and I was on the bed with my arms up on the bed, and I had a pillow there. I did that for a bit with my first, and then I got in the bed and I just basically laid on my left side, held on to the bed, screamed and cried until it was time to push. That's pretty much what I did. And then for my second, I can't remember exactly all of what I tried, but I didn't try much then either. And then again, I laid on my left side in the bed and screamed and cried till it was time to push, pretty much. But with her, it was only an hour of severe pain that I had to cry through, or else the rest of the birth was really well, so that's good. And with my son, I tried to stay on the birthing ball, I think I did at first go on it, and I stayed on it for a while, but my contractions because my water broke, my contractions took a while to pick up. So then I was just trying to get them more so going when I was on the birthing ball, but then again I just laid in bed on my left side holding onto the rail, screaming and crying through the pain. And that is basically I guess for all my labor and deliveries, that's just how it's going to go, because it's just more comfortable for me that way. Also, when pushing, I do have options of, getting in different positions to try and push, to have gravity help. But honestly, I like to lay on my back and push. That is just way easier for me and way more comfortable. And then I have, usually it was my husband holding one of my legs, a nurse holding the other one, and I just push. And I actually do like when they count for you and stuff, and that's kind of what I want, is just to be able to, for the most part, when I go into labor, I actually don't like to stay at home that long. I like to actually stay in the hospital, which is different from most people. Most people like to stay at home as long as they can. For me, I don't like to, but for my midwife's sake, I do try to stay home because she wants me to. Because sometimes in the hospital that is out here where I live, they don't have that many rooms. So if all the rooms are taken and I need to wait for a room, then I have to stay at home a little longer. But yeah, that's fine. But with my son, actually, my contractions were steady. They were I think every 5 minutes apart, which is what my midwife wanted. And then she wanted me to go to the hospital. Yeah, when they were every 5 minutes apart, and they were painful. Get to the hospital, and they stopped almost altogether. So then I had to try to get them to go. I think I tried walking. Yeah, I tried walking, but that didn't work because, what was the reason? Oh yeah, I was really way too uncomfortable. It hurt too much or something like that. So I just basically went back to the room and then waited, and I can't remember what time it was or how far into after my water broke that my midwife gave me a castor oil concoction, so that picked up my contractions. But yeah, for the most part, I guess I'll try to labor at home as much as I can. I just don't know how much faster this birth will go than my other ones. Like, usually they say every child is faster and faster. Well, I don't know if that's the case. In my case would be the case, but for my first it was 13 hours. Second was like 6 hours. And third was 5 hours. So I don't think it'll be that much. I don't think it'll be that bad. Yeah. So I guess I will just stay at home as much as possible. And then, I'm sorry, I'm like, wee, out of it today. And then I'll go to the hospital, and basically my plan is just to do the same thing, which is lay on my left side, hold onto the bed, scream and cry until it's time to push, because that's just the best thing for me. And then, you know, pushing the baby out straightforward. I do not want to see it like with a mirror or something. I think that would gross me out more, and I might feel like there's more pain just because of seeing it. I could be totally wrong, but that's what I feel like, that it's just gonna hurt more just by looking at it. So I just rather not, and I also rather not touch the head when it comes out. I don't want to do that because when the baby comes out, you're all sore down there. I don't want to accidentally touch it or nothing and make it more sore. I guess I'm a little bit paranoid about that. So then baby come out, be put on to me skin to skin, and then hold the baby until the cord stops and everything, and then they will cut the cord and everything, and then, if I'm correct, that's about the time that they take the baby and do the measuring and the weighing and the making sure everything's all good. and then they wrap the baby up and put a little hat on the baby, and then give you your baby back to hold. And I think that's pretty much all of. It's very straightforward for me with that. I don't know if there's anything else that is like, I want this to happen, but yeah, excuse me. I do want me and my husband to have a little bit of time with the baby before everybody else comes in, and also, my kids get to see the baby before anybody else. Like, no one else can come in the room until my kids have seen the baby. But in this case, my mom will be seeing the babies at the same time, or the baby at the same time, not babies, no way, the same time as my kids, because we have 3 kids, and my husband can't watch every single one of them, you know, as we're trying to show them the baby and everything. So my mom can help, because I know my second will just want to run, and my third, I don't know if he'll be walking by then, but I don't want him to be all freaked out like my second was when I had my third. She didn't want to have anything to do with me at the hospital, and she wouldn't want to have anything to do with me for a while. I'm hoping my son doesn't do that, but we'll see what happens. And I do have the option of leaving the hospital like as soon as possible, but I actually like to stay for 24 hours at least to just get used to the baby before bringing the baby home to my other children, just to get a hang of it a bit. So that is, and if I do that, then I actually technically do get more sleep this way, because if I would come home like a few hours after, then I would have to look after my kids too, and they don't just sleep, you know, they're going to be awake, they're going to be playing, so if the baby's sleeping, I won't even be able to sleep, and my husband will be tired, and all of that. And at this point, we don't know if my husband will take off a week. He is an iron worker, and usually in winter, he gets time off, but this will be November, so I don't know if he'll eat, because he's with the union, and if they get laid off, they wait for another job, so sometimes he's on EI for a while. So if that would happen, then he would be home with me, or else I will just, I guess, try to wing it. Pretty much. I've done this so many times, so it seems the healing part and how I feel after seems to get better with each child I've had, so hopefully everything goes good. And I know births don't always go how you plan them, so at this point I'm just really hoping I don't have to have a C-section, and hopefully the baby's not too big. I do know I can give birth to big babies because I had a 9-pound, 1-ounce baby, and I don't think it was that hard getting her out, so I think I'm pretty good with that. So that's pretty much just how it's gonna go. I don't have like a set birth plan, but my midwife knows how I like things. She also knows that I like is it the vitamin K? Where you can get it either drops, somehow give them either drops or a needle. Well, I like the needle because then they have it one time. You don't have to worry about it any other times, like, because with the drops you have to have it given to them 3 times. So I prefer just them giving the needle and then it being done with. And for the drops in the eyes, the only reason they do that is in case you have gonorrhea or chlamydia or stuff. And I know there is no way that I can have it. And a lot of people say you don't know your husband, you can't tell if they're going to cheat or not. I know my husband. There is no way he's going to cheat on me. So I don't have to worry about getting gonorrhea or chlamydia or anything like that. And people may disagree, like, oh, you should get the drops, whatever. But for me, at this point, I don't think I'll get the eye drops. I don't know if I'll change my mind at all, but if I do, I'll put it in one of my pregnancy updates. And so yeah, that is all. Thank you. Hope you enjoyed. Bye.